Um, Something that I've been doing with a group of international leaders from a number of different countries is try to explore the issue of how COVID-19 and the restrictions involved in particular have affected biobanking. So I'm going to share today what some initial findings were from our survey that we conducted. I'm taking these slides from Claire Aloka, who is from NIST in the United States, and she's the chair of this particular task force and the co-chair of the Standards Advisory Committee for ISBUR. Will it advance? There we go. Now, I can't start any talk without telling you all about the Ontario Tumor Bank. A little bit about us anyways. So we're based, our head office is at OICR. We're an OICR funded program. We partner with 4 different hospitals around the province who have a dedicated team in each of those sites to consent patients, process the materials, put it in the freezers, ship them out to researchers and so on. And to date, we've accrued about 22,000 donor patients. This is tumor and blood fractions. We collect clinical data to go along with that. Extensive quality management to ensure that the materials are truly research grade. And we're also able to honor both retrospective and prospective sample requests. Now for our biobank, we experienced quite a lot of challenges with the COVID-19, and we're continuing to experience that. So through the survey, it was quite illuminating how common a lot of these issues are. Going back several months now, it was on the eve of it's on New Year's Eve, actually, is when China reported 41 cases of atypical pneumonia to the World Health Organization. And I don't think any of us could have guessed that that was going to be the main theme of 2020. And we were finding ourselves in the middle of a highly disruptive event in humankind. So this illness quickly expanded beyond the borders of China. The rest of the world watched with deep concern as it, passed from country to country and hit Italy, Iran, Spain really, really fast. And those biobanks were one of the early ones that were affected by this. And they were able to share some of those early warnings and kind of indicate to the rest of us what was coming. That didn't mean that we were necessarily well prepared. And when the World Health Organization announced on March 11th that it's declared a pandemic, biobanks all over the world were very quickly affected by government and institutional directives. One biobank, for example, was told that they had to completely shift their focus and have it implemented within 24 hours. They managed to do it, but you do what you have to when you have to, I suppose. But it's quite a challenge. Some biobanks were told to suspend operations. Some were told to change their distribution and processing or halt those activities. Some were told to start collecting COVID-19. Even some biobanks who had never collected human biospecimens before were pivoted to now being part of that challenge. So it's been quite an impact, and we're learning that biobanks in general, our realm is forever changed. So this isn't a situation that we can ride out, just press the pause button for a few months, and when the world goes back to normal, we can resume our operations. We're learning that the normal that we used to have isn't going to exist anymore, and so we do need to greatly adapt. So a little bit about ISBUR. ISBUR is the only global forum that addresses the scientific, technical, legal, LC issues for biobanks and biorepositories. This is the group that really sets the standard for biobanking internationally, and those standards or best practices are adopted by groups like CAP, who have the biobank accreditation system, or ISO, that has ISO TC276, and so on. And the Scientific Advisory Committee, of which I'm a member, we collectively develop those biobanking standards that are adopted widely. I should note that I'm on the board of directors for ISBUR as well, and I've been serving on the board of directors for several years because I really do believe in what we do as biobankers is super important to research, and I want to be part of the community that makes what we do even better. So a little bit about the Standards Advisory Committee and this COVID-19 Response Task Force. These are the individuals that are from the Standards Committee that joined the task force. You'll see that a number of those are from Canada, but also from all over the world. To supplement this group, we also added a number of subject matter experts, so individuals who were responding adeptly to the situation or who were leaders at large biobanks who could offer some good feedback on what challenges biobanks are facing. Before I move into the whole results from the survey or what the survey is, I want to touch on this terminology, tools and resources, as I'll be using it throughout the presentation. So there are a number of tools and resources that we consider to be available to research or to biobanks. These will be the tools that are developed by the biobank itself, so the policies and procedures that we implement. They may be tools and policies and procedures at the institutional level, but also globally, there's a lot of tools and resources that are available. So the international best practices, NCI best practices, ISO, OECD, CEDARNet is a very good example. The Canadian Tissue Repository Network has a whole series of tools. Those types of things that can make it easier for a biobank to do what they do and do what they do to a level, a really high standard. So to the survey itself, so we explored biobanking experiences during the COVID era. Those results are to be used to better understand how we need to adapt our tools and resources and make those available to the biobanking community. We distributed the survey quite widely. So firstly, through the ISBUR network, we have a membership of about 1,000 individuals representing hundreds of biobanks. And then we went further beyond the boundaries of ISBUR into the general biobanking community. In total, there were 113 respondents from all over the world from between April 6th to April 26th. That's when we closed the survey. This is what the first part of that survey was. It was as, the intro to it. It was like, we are all in this together and wow, what a thing we're going through. Can you please share with us what your experience has been so that we can learn from each other in this crisis? Questions 1 through 4 included demographics and relevant characteristics. Question 5 was an open-ended question. What were your biggest challenges? Tell us about your observations. Question 6, we asked a little bit about the tools and resources that they already have in place and whether or not they found those tools and resources to be useful. This is a snapshot of what the screen looked like, just a partial list. We listed 20 tools and resources. By example, OTB has a majority of these in place, but other more nascent biobanks may only have a few of those in place. And we also included some space for elaboration and free text. Then we asked, well, for the tools that you don't have, based on your experience during this crisis, are you now thinking of implementing some of these tools, and which ones are they? And again, we listed those same ones with elaboration for free text, or free text for elaboration. And then we included 3 additional free text questions. What gaps and lessons have you learned? What additional resources and tools do you think would be helpful to you in the future? And then any comments that they believe would be useful. So who are they? Where in the world? About a quarter of the respondents are from North America. That includes Canada, the United States, and Mexico. 24% from Europe, 5% from Central and South America, quite a number from Australia, New Zealand, Asia, Russia, and the Ukraine, and so on. So quite a good representation of the global biobanking community. We also asked what type of biobank, because I think this makes a big difference in how a biobank is going to be affected by the crisis. If they are collecting environmental and non-human, maybe they're not so concerned about the safety challenges, but they might be concerned about supply chain, about maintaining their existing cohort, about having adequate staff in place. Those who are involved in human collection, so we have the human other, that includes cancer research or human infectious disorders, because we anticipated that the challenges that those kinds of biobanks face might also differ. And then where they were in the COVID curve. So every country was kind of passing through the curve at a different rate. How many of those countries were in the thrust of it, just the throes in their pre-peak, how many were at peak and how many were post-peak. And again, we got a fairly good representation. A question we asked was, who's been asked to handle COVID-related specimens intentionally? And how many were not able to? So a majority of biobanks were not asked to. A number were asked, quite a lot were asked to and could accept that challenge. And then a few were not able to handle the challenge when requested. So I'm sure when we were going through the questions, one thing that might have come to your mind is that's a lot of open-ended questions. How are you going to analyze data when you're collecting free text on a majority of questions? So we divided our task force into teams that looked at different categories and then sifted through all of that data to look for common answers about particular challenges and assign those as a tag. So we had a challenge, we divide them up into categories and then tags under those categories for similar responses. We identified about 25 of those. We also generated a glossary of tags so that we were all working with common definitions. And as we worked through this, it was quite an iterative, organic process so that we could land on something that we were all comfortable with by consensus. These are the challenges that were identified as the top categories. The number there represents the number of respondents out of 113 that claimed that to be a major challenge. It doesn't add up to 113 because the biobank selected perhaps more than one. So at the very top is operations, second is COVID handling, infrastructure and support, business communications, research progress, LC and personnel. So going through the first one, operations, the biggest ticket item was a sudden change, a big change in operations. So immediate closure, suspension to work, staff can't come in, that kind of thing. Sample acquisition stopped. A majority of ethics boards suspended consent for anything that wasn't interventional in nature or that wasn't COVID related. So biobanks that were collecting are not allowed to collect anymore. The challenge of remote operations. How do you monitor a freezer? How do you fill a freezer when your staff are not allowed to come on site? That's a big challenge. And access to samples. So actually being able to get access to the samples that are in the bank. Another category is COVID, so safe and secure handling. There were different challenges for those who are handling it and those who weren't. Surprisingly, those who aren't handling COVID had more concerns about safety than those who are, presumably because those who are handling COVID have taken the time to answer their questions and ensure they have sufficient PPE, etc. And those who don't still have a lot of open-ended questions about what is safe handling in the era of COVID. Sample collection, COVID contamination, and labeling. This was an interesting one, is being able to separate specimens that were collected pre-COVID and those were collected post-COVID, because we don't know for sure if an individual has been exposed or is positive. Infrastructure support. This is another one of the categories, having competent personnel available because individuals were asked to work from home. Or what if your staff gets sick? What if there's a community infection, we have an outbreak related to one of our facilities and we have to send everybody home? How do you monitor your equipment in that time? How do we support individuals who have become ill? And I think all organizations are going through that. That's not really unique to biobanking. The part that's unique to biobanking is what do we do with our freezers? That's a really big one. Supply chain was affected, has been affected for a lot of biobanks. OTB was lucky. We managed to keep our supply chain in place. But a lot of biobanks worldwide suddenly didn't have access to liquid nitrogen. What do you do? Do you find a -80 and transfer all of your samples out? And so that's quite a challenge. Logistics, IT issues, so being able to work with level 4 data, private, personal health information while working at home. So biobanks had to quickly onboard IT solutions. OICR is amazing at this. We had no time at all to get this set up, and IT was just had everything figured out for us. So we were very, very lucky in that respect, but a lot of biobanks worldwide have problems with that. Business and communication, so networking, being able to work with each other was quite challenging. Communications from external organizations, so WHO, CDC, the government, institutional guidelines are changing. At some point, they were changing daily. And that made it very difficult for business planning or operations planning for the biobanks and having to very quickly adapt. Same thing for everybody, I get that. Documentation and training, planning, finances, that's a big one for biobanks, that if we can't distribute, we can't cost recover. And that puts a lot of biobanks in a precarious situation. Another key challenge category identified was research progress. So research just basically halted in a number of areas, especially those doing prospective requests. That donors can't be consented, they can't be recruited. And we're learning now that, again, with, when the pause button is taken off, that we still won't have access to patients in the same way that we did before, because biobanks are hospitals are preferentially moving towards remote or virtual visits. And that looks like that's something that's going to stay. That's both a blessing and a curse. I mean, it's a good thing that we're modernizing. Hooray for modernization. We're starting to make use of all of those technological tools that are available to us, but to have to onboard them and adapt to them in such a short period of time is a serious challenge, both financially and resource-wise. Another challenge identified was ELSI, that's the ethical, legal, societal implications. So how do we collect informed consent? If we used to do consent in person, now I need to onboard an e-consent tool. My goodness, that's starting up a whole new database. I have to go through privacy impact assessment, a threat risk assessment. I need to pay for that tool. I need to configure the tool. So it's taken a lot of biobanks from being able to consent to not being able to consent at all, even if our ethics were allowing it. Personnel was another challenge identified. So personnel well-being, management concern. Some are worried about having to do layoffs or furloughs, worried about protecting our staff and making sure that they're not getting infected, and that we're supporting them if they are infected from a community transmission. And there's also a lot of anxiety. This part doesn't include the anxiety of handling COVID. That was included in an earlier part. But there's a lot of ongoing concern. And one of the quotes from one of the respondents is that job security, work from home arrangement has a negative impact on people's well-being. Distractions from family duties, lack of social communication with peers, uncertainty about the length of the COVID-19 situation further enhances anxiety among staff members. And we as biobank leaders really need to put some effort into supporting our team through this scenario. So questions 6 and 7 asked about tools and implementation. These are the most frequently cited ones as useful. So having some standards in place or aligning with standards like a QMS, a quality management plan, or using ISO, having an emergency preparedness plan, that's a big one. Not a lot of biobanks have one in place. Those who do found it useful, but unsatisfactory for the COVID pandemic. Nobody had a plan in place for pandemics, and we were all kind of reeling from that. And having a business continuity plan in place, relying on best practices like ISBUR, NCI, or targeted tools like CedarNet. So those ones were considered to be useful, not wholly adequate, but useful. These are gaps that were identified. So a lot of them are saying, well, we just didn't have sufficient internal operations to handle this scenario. We didn't have enough infrastructure support to handle the scenario. Business and communications was insufficient, and we didn't know how to handle COVID from a safety perspective. That's basically the takings from this. And then resources and tools for the future. So what do you want in the future to help you with this? It really closely matches that. Although, they're not asking us to build internal operations for them or SOPs, but they are saying, we'd like some guidance on how to handle this from a business and communications perspective, and some guidance on how to handle COVID, even if we're not specifically handling COVID-infected specimens. How do we handle human tissues now in this era? Some guidelines around that would be quite useful. And then we asked them about other comments, so documentation, training, proper conditions, overall performance, and so on. I'm not really going to get into the minutiae of this. Just some, that was the total of the survey. Just a few limitations, that some input was prognostic, so people were imagining what they might go through because they haven't been through it just yet. A lot of these tags are subjective in nature, and we categorize them as experts, but there was some interpretations and inferences that aren't completely unavoidable or completely avoidable. There's some difference in understanding of terminology. Respondents were voluntary, and the survey was only open for a few weeks. So those are some potential limitations. We did learn that there is a diverse range of tools and resources that are useful. We do understand that they weren't wholly adequate for the scenario that, that we encountered. So our early observations are that we needed really good networking, we needed flexibility and agility, we need it. We're in the middle of it now, so we need it. There's a level of organizational resiliency that could have been built in up front in biobanks. And some biobanks did this really well, and others were a little bit blindsided. Well, we were all blindsided to some effect, but how well we were able to pick up the pieces and adapt really depended on how structured the biobank already was in advance. So do we have change management, risk management, reliable monitoring, auditing processes, quality management systems? Do we rely on best practices, and so on? Being able to quickly adapt to alternative consenting processes like teleconsenting, and thinking about operational sustainability in a new way. So there's one quote here from one of the biobanks that, our biobank has been through multiple earthquakes. So that has applied lessons learned to disaster preparedness and operations and recovery, learned ability to go into lockdown within 24 hours. So that's a bit telling, that if a biobank has been through another or has prepared for another type of disaster, that they can be nimble in approaching one that they haven't encountered yet. And that's a concept of resiliency. Having access to tools and resources and implementing those builds resiliency in the biobank. Again, not wholly adequate, but a good part of the way there. What we're learning for the future is that we do need to expand on our best practices and include emergency preparedness as relates to epidemics and pandemics going forward, and to integrate disaster and emergency planning a little bit more deliberately. We're using this global platform, of course, to exchange information and resources to this effect. So where we are now, we did, as a task force, we completed the survey. We presented internationally to, I don't remember how large that group was. It was fairly sizable. It was open beyond ISBUR. And now we've submitted 2 papers that cover the scope of this survey that are in review now. We're hoping will be published in the next couple of months as a COVID special edition in biopreservation and biobanking. Following this, we intend to have a follow-up survey so that we can learn from biobanks and how they finally did manage to overcome these challenges. And we'll follow that up as well with another webinar and some more publications. And I believe that comes to the end of my presentation. Thank you so much.